Welcome to Southern Oregon HBOT, inside of the Neuroclinic. I'm Dr. John Chambers, and I'd like to introduce you to a new therapy to Grants Pass, Hyperbaric Oxygen Therapy. So each of our cells has four basic needs. The primary need of our cells is oxygen. So when we're using a hyperbaric chamber, what we're trying to do is drive oxygen to those cells that through injury or sickness or illness of any sort, post-surgery, might be deprived of oxygen. So in a hyperbaric chamber, what we do is we increase the pressure, and we do that with pure oxygen in this chamber. We're able to take you to about twice, maybe even a little more of the atmospheric pressure around us, and that increases the oxygen availability to your cells. So as we look at this chamber, we'll see it has this big heavy door, and it will contain all of that pressure. So as we put the patient in there, they're surrounded by oxygen, and we're driving that oxygen into their system and improving their healing rate. We also have what are called soft hyperbaric chambers. These are a little bit different than the acrylic chamber in that these are compressed with air and oxygen is driven through an oxygen mask. They don't go quite as deep and they can't deliver quite as much oxygen, but they are a valuable treatment for many conditions. There are many conditions for which hyperbaric oxygen therapy is the treatment of choice. Your doctor may choose to prescribe HBOT for you for those conditions. There's a list of the conditions covered on our website. Hyperbarics actually come from the scuba diving world, so each treatment is called a dive. I'd like to show you what to expect for your first dive. When you arrive, you'll be provided with the clothing and a place to change, and we will also provide you a bag to place your belongings in. Notice that I've removed my watch and my ring, and any belongings that you have need to go in here, as nothing can go in the chamber with you. It's also an important thing to be clean when you go in and not put any lotions or perfumes on as you go into the chamber. The next step is for us to approach the gurney. The gurney is very accommodating. It will go clear to the floor so that anyone who has a difficulty getting on should be able to accommodate. There's also a step stool and a nice little space for us to move. So once you're at this point, the rest is just relaxation. There's a blanket provided for you and a pillow. It's important as you go into the chamber that you are there comfortable, and there's a technician with us here that will help us to get into the chamber at this point. So here we go.
Communication is important while you're in the chamber. Counselor will be here with you the entire treatment, and it's important to know that she can always hear me, and there's a phone for her to talk to me to communicate with you while I'm in here. The rest is just sit back, relax, watch the show, or take a nap.
One thing to watch for when you're in the therapy is that your ears have to clear the pressure. So you will have to clear your ears much like being in an airplane. But once you can clear them, they're just fine. Oxygen is one of the most important needs of our nervous system and our whole body. As we drive oxygen to your system, it can help you to heal at a much faster rate. We're excited to see you at Southern Oregon HBOT for your first time.